Hello, my name is Brianna Stigler, and I'm a second-year PharmD candidate at DeUval College's School of Pharmacy. I just want to thank you all for taking time out of your day to watch my journal club video. The article that I chose for this journal club was the effect of Brexpiprazole on agitation and hostility in patients with schizophrenia. I chose this article because I find mental health to be a very important topic, and I feel that we should be more educated on the different treatments that are available to patients, especially those in the schizophrenic population. The authors of this article are Sitram L, Yuying J, and Shi L, and this article is from the Journal of Clinical Psychopharmacology. The primary objective of this study was to evaluate the efficacy of Brexpiprazole compared to placebo for reducing agitation and hostility in patients who are hospitalized with an acute exacerbation of schizophrenia. The primary efficacy that is analyzed in this trial was the mean change in the positive and negative syndrome scores from baseline to week 6. The positive and negative syndrome scores are also known as PANSS scores. This study was designed as a prospective, randomized, double-blind, placebo-controlled trial. The patients involved in this trial were ages 18 to 65, and they were experiencing an acute exacerbation of schizophrenia that required them to be hospitalized. The inclusion criteria for this study include patients who have an Axis 1 diagnosis of schizophrenia, patients experiencing an acute exacerbation of schizophrenia, patients who have a history of hostile or aggressive and agitated behavior, and patients who benefit from hospitalization during their exacerbations. The exclusion criteria for this study include if this patient's exacerbation is their first episode of schizophrenia, if the patient has an Axis 1 diagnosis of something other than schizophrenia, also if the patient has clinically significant tardive dyskinesia, and if the patient also has a substance abuse or dependence that has occurred in the previous 3 months. This study comprised of a 14-day screening period, a 6-week treatment phase, and a 30-day follow-up phase. The primary analysis of the primary outcome was conducted on an intent to treat population with an alpha that was set at 0.05. The study needed 1,036 patients in the Brexpiprazole subgroup in order to have a power of 95%. The study enrolled 1,094 patients who were included in the primary analysis. The results of this trial concluded that 789 patients who were randomized had hostility at baseline, which was defined by a P7 score of 2 or greater. At week 6, Brexpiprazole 4 milligrams was superior to the placebo subgroup in reducing the PANSS scores from baseline, whereas Brexpiprazole 2 milligrams only showed slight numerical improvement from baseline. Tolerability of Brexpiprazole in the patients. Of the patients in the placebo subgroup who had baseline hostility, 55.9% of them indicated that they experienced at least one adverse effect due to the medication during their 6-week trial. The subgroup with Brexpiprazole 2 milligrams had 61% of patients state that they had at least one side effect due to the medication, and finally the subgroup of Brexpiprazole 4 milligrams had 61% who indicated that they had a side effect due to the medication. There was a similar incidence of adverse effects that were also seen in patients without hostility at baseline. The author concluded that the results of the trial indicated that Brexpiprazole was a well-tolerated and efficacious treatment for agitation and hostility in schizophrenic patients. The strengths of this study include that the power was set and met, that the biostatistical tests were appropriate for the data type, the outcomes measured were valid and accepted in practice, the inclusion and exclusion criteria were adequate, there was randomization and blinding present, the length of the study was appropriate, the treatment regimen was appropriate, including the dosage that patients were given. The author's conclusion was supported by the results, and there was a larger sample size with a low dropout rate. Limitations of the study included volunteer bias, which was present due to the fact that patients had to be hospitalized with a schizophrenic exacerbation in order to be considered for this study. Additionally, the dropout rate was only due to the adverse effects and withdrawal of consent of patients. The level of evidence that is present in this study is a level 2, and it's limited by its minor limitations. For my recommendation, I would recommend that Brexpiprazole be used over placebo in the treatment of aggression and hostility in patients with schizophrenia exacerbations for the following reasons. It did show to have an advantage over placebo for Brexpiprazole 2 milligrams and 4 milligrams, respectively, with p-values of 0.020 and 0.0002, indicating that these are statistically significant and the data is accepted. Additionally, for Brexpiprazole 4 milligrams, it had a benefit over the placebo treatment, and it was seen at every weekly visit rather than just at the end of the 6-week trial. The incidence of adverse effects due to medications was found to be similar in both groups, with hostility at baseline and not at baseline. The cost of this medication would be considered low due to the fact that a manufacturer's savings card is available, which would have a zero copay for the first 2 months of use, and then eligible patients would pay as little as $15 for a copay for the remaining refills. Additionally, if people have private insurance, although it does vary based on insurance plans, the average cost of a 1 month supply is $36.64. The use of Brexpiprazole was studied in special populations. In pregnancy, the use of Brexpiprazole in the 3rd trimester could cause extraparietal issues and or withdrawal symptoms within the neonate. In the elderly, Brexpiprazole is not indicated and or approved for treatment of dementia-related psychosis. Additionally, dose adjustments are required in hepatic impairment, renal impairment, and CYP2DS poor metabolizers. In conclusion, I agree with both the author and my recommendation for the use of Brexpiprazole in schizophrenic patients. I hope that this information was useful, and I thank you for your time.